All right, the topic of our video lesson today is on the skeletal system. So let's get started. Now, before we actually start looking at the human skeletal bones, I just want to take a minute to discuss sort of the anatomy of a long bone. So this would be an example of a skeletal bone. And what I want you to see is we have a shaft part of the bone, which is called the diaphysis. And then there are ends of the bone, okay, the epiphyses. Now, at the ends of the bone, there's a type of bone called spongy bone. And there are spaces within that bone. It's lighter. And within that spongy bone, we find red bone marrow, where blood cells are produced. And then the shaft is going to have something called compact or cortical bone, which is, as it sounds, more compact, right? And it doesn't have as many spaces. It's more dense. And you can see there is a cavity in the middle of that bone. So it's not solid all the way through. There's a cavity, and in the cavity, we find some yellow marrow and some fat store. The last thing I want to point out here in this image is you see that there is some articular. So articular meaning where a bone articulates, right, or forms a joint with another bone. So some cartilage there where that's occurring. Now, I mentioned to you compact bone or cortical bone. And so let's just talk about, I just want to make sure you remember from previous lessons that bone is living tissue. There are living cells in bone tissue. It's not just this hard matrix with no cells left. So if there are living cells, there has to be a way that they receive blood supply, so nutrients and oxygen in that blood, and then the blood carries away the waste, and they also have to receive signals from nerves. So this is an example of how that works. There are these circular repeating units within bone tissue, within this hard mineral matrix. And here's one that is sort of brought to your attention. These are called osteons, and you can see the arteries and veins present in that. And one thing you can't see is there's also would be innervation or nerves that are also traveling through the canal there. Now, another thing to see is on the inside, we see some of that spongy bone. It's a little less dense. And then we have the compact or cortical bone around the outside. All right, now let's jump into the human skeleton. And I want to start with saying that there are actually 206 bones. However, you do not need to memorize all 206 of those, so hopefully that's good news. I want you to first start by thinking about the skeleton as being either part of the axial or appendicular skeleton. So axial, think of axis, right? Sort of in the middle. Appendicular, think of appendages, which would be like arms and legs, right? Your limbs. So those in blue then are what are the axial skeleton bones, and those in red are those that are the appendicular bones. Now we're going to spend a little more time looking individually at the appendicular bones, but I want to just spend a little time with the axial bones. So the skull obviously is one of those. I'm sure you're familiar to a certain extent with the skull, but this bone right here, the hyoid bone, might be something you've not heard of before, or at least are less familiar with. So you can see this bone is pictured just under the jawbone or the mandible. And this is an interesting bone because it doesn't articulate with any other bones. It's attached with muscles and ligaments. Now the other thing we can see the thoracic cage, right, which is the ribs. And this bone right here in the middle of that rib cage is the sternum. And then we can see the vertebral column, right, which are the individual vertebrae. Then at the bottom of the vertebral column, we have some fused vertebrae that are called the sacrum. And at the very, very tip, okay, below the sacrum right here, we have something called the coccyx, which you might refer to as your tailbone. Now, this is a list of the bones that I want you to be familiar with that are part of the axial skeleton. So we walk through each of those for the axial skeleton, but we're going to now switch gears and walk through the bones of the appendicular skeleton, looking at both the upper limb and the lower limb. Okay, so I mentioned already the ribs and the sternum, but I just wanted to show you this image so that it identifies a little bit larger the sternum for you that the ribs are connected to, and then you see the vertebral column in the back or posterior area. Now we're starting with the appendicular skeleton. Okay, this is going to be looking at the upper limb. So the first bone I want you to look at is the clavicle, this right here. So we're looking at the front, right, or the anterior view. That might be what you would call your collarbone. So you can feel that now, right, sort of at the front, just to either side of your neck. You can feel probably the clavicle there. Now, if we look at the back view or the posterior view, we can see the scapula, which you probably call your shoulder blade. Now, if we look, okay, we can see a little bit of the shoulder blade here, right? And if we look, what bone is articulating or having a joint with that shoulder blade? Well, that is the upper arm bone, or what we would call the humerus. And then the lower arm actually has two bones that are present, the ulna and the radius. And I want you to look at the arm. So we're going to look down at the fingers, okay? And I want you to notice that the shortest one is going to be the thumb. So this one here, right, is the thumb, which would make this side over here the pinky side, right? And the reason that I have identified that to you is what I want you to see is the ulna, okay, is on the same side as the pinky, and the radius is on the same side as the thumb. Now, this is just a little extra FYI, but if you go into a health profession, or if you ever take anatomy, or maybe you watch, crime shows on TV and they talk about autopsies or something, they may refer to anatomical position or use anatomical terms. This arm is shown in anatomical position, and if you want to assume that position, if you're standing up, facing forward, with your arms out to the side, you would have your palm facing forward and your thumb on the outside. So that's what's being pictured here in this image. Now let's work our way down. At the wrist, we have 8 small carpal bones, okay? And as we move out, the next group of bones would be the metacarpals, okay? And then the fingers would be called the phalanges. So that's the list of bones that I'd like you to be able to identify for the upper appendage or the upper limb. Now we'll move to the lower limb. So one bone that's barely pictured in this image is up here, okay? The coxal bone, which is probably what you would refer to as your hip bone or maybe your pelvis, okay? And the upper leg bone, the longest bone in the body, is the femur. And then there are 2 lower leg bones, like there were 2 lower arm bones, and these are the tibia and the fibula. The tibia is the larger of the leg bones, and it is more anterior or more to the front, and the fibula is a little more lateral and posterior. You don't need to know those terms, but sort of to the side and a little toward the back. I remember it this way. The tibia is too big to be the fibula. I don't know if that helps you. But the patella, right, is right there at the knee joint. And then if we get to the ankle, there are small bones in the ankle as well. And in the ankle, they're called tarsal. So what were they called in the wrist? Yes, they were called carpals. So the next group of bones out from the tarsals would be the metatarsals, whereas in the wrist they were called the metacarpals. But there is no difference between fingers and toes. They're all called phalanges. Now, there are several different types of joints that can be formed between when two different bones come together. So the first that you see pictured there in letter A is in the skull. And these are called sutures. And they basically have no cavity between them, and they have almost none, right? No or very little movement. And the connection there is just fibrous connective tissue. Now, if we move to letter B, this is a cartilaginous joint. Okay, in other words, it's cartilage that's doing some of this, doing the connection. Now, there is some movement, but little movement, right? More than the suture. But our next joint is the one that provides the greatest amount of movement. And there are different types of these. They're called synovial joints, so they're not all the same. So if you think about the movement of your elbow and your knee versus the movement of your shoulder, right? Your shoulder has a greater range of motion than the elbow or the knee, but they're all synovial joints. Now, a synovial joint actually has a space in it that has fluid. And what does this do? Well, it's going to reduce friction, right? It provides some lubrication. Additionally, there is cartilage there on the ends of the bones. Remember, we looked at that long bone and they had that articular cartilage. That's going to be present within that synovial cavity.